The evidence is that the early years are very significant for human beings. And part of that really is especially for infants and children's emotional development. So if infants grow up in an environment where they have responsive parenting, which means that the parent is kind of sensitive to them and also kind of attuned to them, then they come to realise that they are to be loved and valued as human beings, and that how they act in the world matters to other people. So they develop kind of a positive sense of themselves, and also they have the capacity then to be empathic with other people. And they're some of the factors that are very important for later development. So it's kind of like if you feel secure in yourself, then you're able to go out and explore your environment. So it enables children and infants then to explore their world and to know that they can come back to the parent to be safe. So it helps with their social development, their emotional development, and their later language development. The more adverse childhood experiences that infants and young children experience, the more likely there are to develop physical health problems and also psychological problems in later life.
Well, in Ready Steady Grow, we have partnered with the Ballymun Public Health Nurse team to provide a programme called the Parent-Child Psychological Support Programme. And this is for all babies and parents in the Ballymun area. We chose this programme in particular because it's really strong in its appreciation of a parent's role in their infant and toddler's social and emotional development. Because the parent's own well-being will have a huge influence on their care for their baby.
They were asking things like, and how are you, and do you get time to yourself and stuff like that. Like they were concerned, like not only for the child, for yourself as well.
We're also linked in with the Ballymun Infant Mental Health Study Group. So I would attend that every month, and that would be attended by community psychologists, speech and language therapists, public health nurses and other professionals that would be involved with infant mental health. And the learning from that study group then I can bring back and share with other staff in the setting, and hopefully it helps us to best support the needs for children in that age group. So we would do a lot around naming children's emotions. So if a child is upset, rather than just trying to distract them all the time, that you would go, oh, you're upset, you're crying, or you're angry. Or it could be positive emotions as well. Oh, look at Tyke, he's smiling, he's laughing, things like that. And that means that children begin to understand about emotions.
What I'm involved in is the parent programme. So we run the parent programme and it's based in the schools. So it's a 12-week programme, and what we do is we cover many different strategies. And again, it's so that the children get a holistic support and positive reinforcement. So they're getting it at school and they're getting it at home as well. I definitely think it reduces stress levels. We evaluate the programme constantly, and there has been really good results at parents' stress levels being reduced. If you're more confident in your parenting role, then better for your mental health, absolutely.
I did it because first I want to be a better parent. I think we all do our best, but you can, like everything, you can always do better. It can be stressful, everybody knows that. But if you're, if you learn techniques and ways of being parenting without getting stressed, well, ultimately the whole family benefits then.
My son actually said it to me this morning about the course, that it was a great course. And I says to him, well, why is it a great course? And he says to me, because the last couple of weeks, that there's been no shouting. There's no animosity or nothing in the house. It's a total different household now.
Well, transfer from primary to secondary school was one of the key challenges that was identified. It's a time of particular challenge for all pupils, even those with very positive social and emotional development. So for that reason, we need to put not just academic supports in place, but social and emotional supports also. The research would say that supports that include family, the child and the school are those that work best. From the school's point of view, it involves allowing children the time to air their concerns, to look at the worries that they have, look at their fears.
This year I've noticed a difference in how my children are preparing themselves for secondary school. There's less anxiousness, less fear. They're a little bit concerned, I suppose, about will they make friends, or will they settle in, or will they find their way around the place. But there isn't the fear, the anxiety that children have had before. I think at the end of the day we're here to help the children, prepare them for new changes, new challenges in life. And this is a new chapter in their life. And at least if they're going in well equipped, they can face the unknown.
If you talk to psychologists about this, they will tell you family is crucial in the support of children. Having a significant adult that any child can talk to at a time of change or a time of flux is hugely important and very influential. So we take on board the role of parents in a very big way.
We have awareness raising whereby we're trying to get people to think about mental health and to get people to think about mental health in the way that we might think about our physical health. So just like we all have blood pressure and it can go up and down, we all have mental health. Sometimes it's good, sometimes it dips. It's something we need to look after, but it's not something to be scared or anxious about. What young people are saying is that when they're experiencing difficulties, that what they want is to have somebody to turn to and someone to talk to. And they're not talking about a psychologist or a psychiatrist. They're talking about somebody in their life, be it a parent, an aunt, an uncle, someone in the community that they have a good relationship with, a sports coach, teacher, a youth worker. So based on this premise, the design of our service is that the more frontline practitioners that we can upskill regarding youth mental health, the better chance we have that when young people encounter a difficulty at the early stage, that they can get help then and there and that it doesn't escalate.